Hello, welcome to Enchiridion Chiropractic Training, where we are committed to advancing the chiropractic profession and empowering you with the latest insights for better patient outcomes. If you're passionate about improving care and staying ahead in this field, please don't forget to hit that subscribe button, hit the bell notification, ding ding, give this video a like and share it with your colleagues. Your support helps us reach more practitioners and makes a real impact in chiropractic care. Don't think, feel. It's like a finger pointing away to the moon. Don't concentrate on the finger or you will miss all that heavenly glory. Now that's from a film that was pivotal when I was a child growing up. I'm not going to tell you the title, but I'm sure if you know, you know. And I popped this on the front of this excellent article by Steve Porges. It's called Stress and Parasympathetic Control. In today's video, I'll be summarising what this has taught me, some key points, and I really think we as chiropractors need to understand we have a pivotal role to play in our patients' care. So, today we're talking about the science of stress, the parasympathetic nervous system, and chiropractic care. Hello everyone, my name's Aidan and welcome back to the channel. Today we're diving deep into the neuroscience of stress and how the autonomic nervous system, or ANS, particularly the parasympathetic system and the vagus nerve, or the 10th cranial nerve, affects everything from heart function, digestion, inflammation, and even our social behaviour. We'll break down Dr. Stephen Porges' Polyvagal Theory to explain how chronic stress alters the brain to body communication and discuss how chiropractic care influences autonomic regulation at a physiological level. This isn't just about spinal alignment, it's about optimizing the entire nervous system for better health, recovery, and of course, resilience. Whether you are a patient of someone else or a chiropractor, this will give you a scientific framework for explaining how your adjustments impact the patient's vagal tone, their heart rate variability, and immune function. This means your patients will understand why chiropractic is far more than pain relief. It is a stress reset treatment for the whole body. So, let's get into it. So first, let's understand the autonomic nervous system, or ANS, the foundation of our health. The autonomic nervous system is the master regulator of all involuntary functions: heart rate, digestion, respiration, immune responses, endocrine function, and even our emotional and social processing. It operates beneath consciousness and has two primary branches. The first is the sympathetic nervous system, also called the fight or flight. This will increase our heart rate and blood pressure via catecholamine release, which is epinephrine and norepinephrine. It dilates our pupils for enhanced vision. It redirects blood flow to muscles and away from digestion, and also releases cortisol via the hypothalamic pituitary adrenal axis. In addition, it suppresses our immune function by shifting energy away from maintenance processes and increases our blood glucose via hepatic gluconeogenesis. The second part is the parasympathetic nervous system. This is sometimes called the rest and digest, or the feed and breathe. This will slow heart rate via vagus nerve mediated inhibition of the sinoatrial node. It will stimulate our digestion through the vagal control of peristalsis and enzyme secretion, and enhances nutrient absorption by increasing blood flow to the gut. In addition, it supports our immune function through the cholinergic anti-inflammatory pathway and promotes neurogenesis and cognitive flexibility by modulating our brainstem nuclei. And what this means, of course, is that a healthy nervous system must maintain a homeostasis by fluidly shifting between sympathetic and parasympathetic states based on that individual or organism's need. However, if we're exposed to chronic stress, we can dysregulate this balance, which will lead to sympathetic dominance and can, unfortunately, lead to vagal dysfunction. So what is the vagus nerve? So the vagus nerve is the 10th cranial nerve, and it is the primary parasympathetic nerve acting as the communication highway between the brain and the body. It originates in the brainstem and extends throughout the body, innervating the heart. In the heart, it slows heart rate and modulates something called heart rate variability. In the lungs, it regulates breathing and bronchostriction. In the liver and the pancreas, it controls both blood glucose and insulin secretion. In the digestive tract, it stimulates peristalsis and enzyme release. And in the immune system, it regulates inflammation by the cholinergic anti-inflammatory pathway. In the cortex and limbic system, it modulates mood, social behavior, and our emotional regulation. Critically, it's important you know that 80% of vagal fibers are afferent, meaning they send sensory information from the body to the brain. And this means that dysfunctional vagal signaling doesn't just affect our digestion and heart rate, it will also alter our cognition, mood, and in fact our overall resilience to any form of stress. Chronic stress will then lead to autonomic dysfunction and ultimately the breakdown of regulation. In an acute stress response, sympathetic activation is beneficial. Remember, it allows us to react quickly, escape danger, and mobilize that all-important energy. However, when it becomes chronic, whether that's from processed food, poor sleep, social isolation, poor overwork or unresolved trauma, this will keep the sympathetic nervous system activated. What does this lead to? Well, first of all, elevated cortisol and chronic inflammation. This increases our risk of cardiovascular disease, diabetes, and neurodegeneration. But it also will lead to dysfunctional vagal tone, which then perpetuates impaired stress recovery and, in fact, heightened anxiety. You can get a dysregulation of the gut-brain axis leading to leaky gut, IBS, SIBO or dysbiosis, a suppressed immune function leading to higher risk of infections or even autoimmunity. And of course, you can also develop chronic muscle tension and pain due to altered proprioception and spinal dysfunction. If the parasympathetic system fails to counteract this prolonged stress response, then patients will in fact get stuck in a cycle of stress, pain, and slow recovery. This leads us to the Polyvagal Theory, the 3 evolutionary stress response systems. As I said, this was developed by Dr. Stephen Porges, and his Polyvagal Theory explains that the autonomic nervous system evolved in 3 distinct phases. Number 1, the ventral vagal system, or social engagement mode. This is the most involved system. It allows for calm, connection, and communication. It inhibits excessive sympathetic activation whilst enhancing HRV, digestion, and cognitive flexibility. It allows us to engage in eye contact, improves our facial expression, and our vocal tone. Number 2, sympathetic nervous system, fight or flight mode. This mobilizes energy for survival by increasing the heart rate, respiration, and glucose release. In addition, it suppresses the digestive and immune system and prepares for short-term action, not long-term health. Number 3, dorsal vagal system or shutdown mode. This is the most primitive system and engages when stress is overwhelming. the individual will freeze. Their metabolism will slow right down, their heart rate and their digestion will really reduce, and this can lead to fatigue, depression and emotional numbness. And when people experience chronic stress, they can get stuck in sympathetic or dorsal vagal states. This makes it harder to regulate emotions, recover from exertion, or in fact maintain their optimal health. So, how can we as chiropractors adjust our patients and improve vagal tone and stress resilience? Well, first of all, spinal adjustments influence the autonomic nervous system via the brainstem and vagus nerve, as well as spinal cord pathways. Adjustments into the upper cervical, that is C0, C1, C2, enhance vagal tone by improving our brainstem function. This can lead to an increase in HRV, which is a key biomarker of stress resilience. In addition, it will optimize cerebrospinal blood flow, reducing tension and anxiety. Thoracic spine adjustments to T1 to 5 reduce sympathetic overdrive and shifting the body into parasympathetic dominance. They will also improve heart and lung function. From S2 to S4, adjustments of the sacrum enhance pelvic and digestive function, support the gut-brain axis, and improve overall regulation. Finally, adjusting the posture restores a proper afferent signal to the brain. This can also improve breathing mechanics and vagal stimulation. A 2018 study found that chiropractic care increases HRV, suggesting an improvement in autonomic balance and stress resilience. Finally, chiropractic is a nervous system therapy. It isn't just about pain relief. It's about restoring autonomic balance by enhancing vagal tone and spinal integrity. Chiropractic will help shift the body from sympathetic overdrive to parasympathetic healing mode. It will improve your stress resistance or your patient's stress resistance, their recovery and HRV. In addition, it will support the immune function and the gut-brain health, as well as enhancing cognitive clarity and emotional regulation. If this deep dive was helpful, hit like, subscribe, drop a comment, and tell me, what is your favourite way to reset your nervous system? See you in the next video. Stay healthy, keep adjusting those patients, and let's optimise you, your and their nervous system. This is Aidan from Enchiridion Chiropractic Training, signing off. Bye-bye.